Let's talk about the knee. Specifically, let's talk about the cruciate ligaments and where they live. First thing I want to do is just very briefly review the anatomy of the distal femur. So remember that long bones have a shaft. This is the shaft right here, which is the longest part of the femur. As we move more distally, the bone balloons out. That's called the metaphysis. And you can see here that you've got a lateral femoral condyle and a medial femoral condyle. Now you can't tell easily which one is which because we're not including the proximal femur or we're not including the tibia and the fibula here. But take my word for it. This is the lateral femoral condyle and this is the medial femoral condyle over here. When we flip the bone over, you can see that there is a notch that lives between the femoral condyles. And the notch is called the intercondylar notch. And that's basically right here. So here's the intercondylar notch. That's where the cruciate ligaments live. Now, in keeping with the high production values of Tigges Studio, let's go ahead and pull out this Netter flashcard right here that's going to we're going to use to very briefly review the cruciate ligament anatomy. Here is the anterior cruciate ligament. It arises from the medial aspect of the lateral femoral condyle and goes anteriorly to attach onto the tibia. This right here is the origin of the PCL, and you can see that it comes off of the lateral aspect of the medial femoral condyle. Now that can be a little tricky to remember, so I'm going to give you a hint as to how you can remember this anatomy. If you take your fingers, in this case, these are the fingers of my right hand, and you cross the fingers of your right hand, that reproduces the course of the ACL and the PCL in the right knee. So the anterior finger here, and this is my long finger, that's going to be the ACL. So remember that the ACL goes from the medial aspect of the lateral femoral condyle, and it goes anteriorly to attach on the anterior aspect of the tibia. Posteriorly, this is my index finger, and it is going to reproduce the course of the PCL. And the PCL, remember, goes from the lateral aspect of the medial femoral condyle and goes posteriorly to attach to the tibia. Now, it works similarly for the left knee, but when you're reproducing the course of the cruciate ligaments for the left knee, you need to use your left hand. So I'm going to go ahead and just slide this over. So if you're going to do your left knee, you're going to have to use these fingers on your left hand to reproduce the course of the cruciate ligaments. Remember, cruciate means crossed, and as you can see here, the ligaments do indeed cross. Thank you.